So, what's your job title and
My job title, I'm a professor at UCLA in the Department of Head and Neck Surgery.
and how has your career changed since it began?
Well, it's been a long road to become a surgeon. After high school, it was college, then medical school, then 6 years of residency, and then 1 year of fellowship. And I've been in practice now for 6 years.
So you took medical school to get there?
Yeah, so medical school is after college. I went to UCLA. It was a 4 year medical school where you kind of rotate through all the different specialties and then decide what you want to do afterwards.
And where do you work?
So I work at UCLA. It's based in Westwood, but we have satellite offices in the Valley, in Santa Monica. We cover quite a bit of Los Angeles.
And do you enjoy the environment you work at?
Yeah, no, UCLA is a great place. We have a lot of research. We have great medical students, really excited faculty, and just really interesting cases that come through, a lot of interesting pathology.
So, what do you do on a daily basis?
So my specialty is to treat people that have sinus disorders. So, for example, I treat patients that have chronic sinusitis, so chronic infections, allergies, breathing problems. I treat them either with surgery or medical therapy. I also treat sinus tumors. So that's a new field. In the last 10 years, we've been treating a lot of sinus tumors and cancers with an endoscope through the nose, so minimally invasive surgery.
Yeah. And do you work with anybody else?
Yes, I work very closely with allergists. I work closely with infectious disease specialists, and I work very closely with neurosurgeons for the brain tumors that we take out from time to time.
And do you collaborate with them often?
I do, and I also do some research with some doctors that are chemists.
So you do research on microbiology, right?
I do.
And what do you research about microbiology?
So recently, I've been working with a very famous microbiologist who works in the Veterans Hospital, which is affiliated with UCLA. And what I'm looking at is the sinus bacteria flora. So very much like the gut has regular bacteria that are part of the healthy gut flora, we now know that the sinuses have something very similar.
Hmm. And do you have any advice for anybody that wants to pursue this field?
Yeah, I would say you want to get exposed to it as early as possible. It's a very long road to become a doctor or a researcher or a scientist or a nurse or any number of fields. But when you're in high school, obviously you want to be interested in the sciences. So you want to love your biology, love your physics, love your chemistry. When you get to college, I do recommend taking those pre-med classes, but also volunteering, whether it's in a hospital, a homeless shelter, or a clinic. You want to get exposed to it as early and often as possible to figure out if it's the right field for you.